So today practical is on helminthic infection, parasitology. I'll make it very sweet and palatable. What? Everybody. Sweet, and although it is not a very sweet, most of the infections are caused by either से either. क्या? Fecal. हाथ हाथ सब अच्छे नहीं धोते ना, वैसे ही खाते तो सब हेलमेंथिक इन्फेक्शन होता है. सो आज से क्या करना, बिफोर खाने खाने से पहले क्या करने का, हैंड वॉश यू शुड डू. इफ देर इज नो वाटर एंड इफ देर इज नो सोप, व्हाट यू विल डू? टिश्यू पेपर ऐसा ऐसा करने का. Some people are very fond of smelling their own sweat, you know that, and they do like no, huh? So that is a part. I am still not able to understand. With lot of enthusiasm and interest, we take class. People do not attend class. Why? So there is never is this kind of indifferent attitude of students in any colleges. I taught in almost 9 colleges. So why there is so much indifference for attending classes? See, we have done a calculation as a part of a private medical college team, where we calculated each class of one class of microbiology costs you 1 lakh rupees. How much? 1 lakh rupees. Lakh of rupees. Anatomy, physiology, they all cost 1.5 lakhs. Medicine and all cost 2 lakhs, one class. So this is all taking into consideration infrastructure, hospital, the amount we spend on each student is enormous. So that's why government colleges, if you get a seat in government college, you have to serve at least a couple of years as a bond, so that they will recover that money, putting you into the rural area. So continuing parasitology, in nutshell, I said parasitology, study of organism which live on other host for their खाने पीने के लिए दूसरा होस्ट के. डोंट थिंक आई एम वेरी फॉन्ड ऑफ इम्पोजिंग हिंदी. आ जाता है कभी कभी. सो आई एम नॉट this thing imposing you on Hindi. All you speak Telugu only, no problem. So they depend on other organism for their nutrition. So parasite is one organism which live on other host for their nutrition. There are 2 types of host. Everybody repeat with me. There are 2 types of host. How many types? There are 2 types of host. One is definitive host. Another is intermediate host. Definitive host, everybody. Definitive host is defined as when parasite leads adult life or sexual forms. Intermediate host is defined as when parasite leads asexual or larval stage. Hold like this. Man acts as intermediate host in 2 parasitic conditions. Number 1, malaria. Second, Echinococcus granulosus, which causes hydrated cyst in the liver. Which causes hydrated cyst in the liver. Which causes hydrated cyst in the everybody. Echinococcus granulosus. It is also called as dog tapeworm. It's a zoonotic parasitic disease. Life cycle will be going on between sheep and dog. Man get accidentally infected by fondling the dog without washing the hands, eating the food which contains eggs of Echinococcus granulosus. And this worm goes to the liver, forms hydrated cyst. As you already know that malaria is caused by, hold like this, 5. Plasmodium, vivax, oval, falciparum, malariae, novalaceae, Paradeshi novalaceae. Vivax, oval, falciparum. It is called falciparum. Gametocyte looks like banana or sickle. Fox. Banana or sickle. Falciparum. It's most dangerous. It causes cerebral malaria because schizogony takes place in the cerebral vessels, arterioles of the cerebrum. And black water fever, there is hemoglobinuria. The urine becomes black and it is very dangerous. It's very dangerous. Okay. Now moving on to the parasites. They are broadly classified into everybody. They are broadly classified into protozoans, and helminths. Everybody. They are classified into unicellular protozoans and multicellular helminths. The protozoan important infections are, the first one is Entamoeba histolytica. What is that? Man get infected by eating food and drinking water which contains quadrinucleate cyst, and it passes up the stomach. It passes the stomach without alteration in the intestine. Existation takes place. What is it? Existation takes place in the intestine. Existation takes place. 8 amoebulae are released. They are transformed into trophozoites, and they come to the descending colon and sigmoid colon. They give rise to flask-shaped ulcer. They give rise to flask-shaped ulcer. They give rise to flask-shaped ulcer. Some of the trophozoites through the portal vein go to the liver and cause amoebic liver abscess. Some of the trophozoites, everybody, some of the trophozoites through the portal vein, they go to the liver, cause liver abscess. When you aspirate liver abscess, it is chocolate colored. It is called as anchovy sauce. From the liver, it goes to lung and gives rise to lung abscess. Through the blood, it can go to the brain. It can cause brain abscess. It can cause abscess in the kidney. It can cause abscess beneath the diaphragm, subphrenic abscess. Direct invasion from the intestine to the skin, it can form amoeboma. It can form amoeboma. Laboratory diagnosis is done by examination of stool and doing the saline and iodine preparation. Iodine preparation is done for demonstration of cyst. Saline preparation is done for demonstration of trophozoite. So it is done, everybody, examination of stool for iodine preparation is done for the demonstration of stool, and saline preparation is done. Saline preparation is done for demonstration of trophozoites. So treatment is metronidazole or tinidazole. We'll come back to the details of metronidazole and tinidazole, dosage and half-life and excretion and side effects and all those things. Now, for a moment, you remember it as metronidazole or tinidazole. Metronidazole nowadays we are not giving because it is found to be carcinogenic. It is found to be carcinogenic. Next is Giardia lamblia. Giardia lamblia. Man get infected by consumption of cyst present in the food and water. Man get infected by consumption of food and water which contains cyst. Habitat of parasite is DJ, duodenum, duodenum and jejunum, and trophozoites looks like badminton racket. It's a flagellate. Okay, so it causes steatorrhea. Malabsorption of fat is called steatorrhea. What is it? Malabsorption of fat. So, and demonstration again is done by iodine and saline preparation. In iodine preparation, you look for cyst, and for demonstration of saline, you look for the trophozoite. Okay. Third parasite in this thing is Trichomonas vaginalis. Trichomonas vaginalis. Trichomonas vaginalis. It is sexually transmitted parasitic disease. Everybody, sexually transmitted, not sexually. Sexually transmitted parasitic disease. No, no. Sexually, not sexually transmitted parasitic disease. When patient comes to take, both the partners, male and female partners should be treated. When gays or lesbian comes, both the partners should be treated. Okay. It gives rise to urethritis. It gives rise to urethritis. And it gives rise to no cyst. Please remember, we asked what describe the cyst of Trichomonas vaginalis. No cyst. Please remember, multiple choice question. No cyst. No cyst in Trichomonas vaginalis. It causes urethritis and vaginitis. Vaginitis in female and urethritis in male. Vaginitis in female, urethritis in male. Now, fourth parasite in this group is Trypanosoma cruzi. Trypanosoma cruzi. Everybody, Trypanosoma cruzi. Man get infected by the bite of Rudevid bug. Rudevid bug. Man get infected by the bite of Rudvid bug. It gives rise to Chagas disease. Next one is Trypanosoma brucei. Trypanosoma brucei. It gives rise to sleeping sickness. It gives rise to man get infected by the bite of Cestodes fly. Man get infected by the bite of Cestodes fly. So sixth parasite in this group is malaria. Malaria is caused by 5: Plasmodium ovale, vivax, falciparum, malariae, and novalaceae. Man get infected by the bite of female mosquito. What mosquito? So all females are non-vegetarian and bloodsuckers. Do you agree with me? Yes, sir. Very good, sir. So man, but necessity is mother of invention. Female mosquito needs human blood for laying eggs. What? Female, everybody. Female mosquito needs human blood for laying eggs. So necessity is mother of invention. Copying is very essential to pass the examination. Do you agree with me or not? Yes, very good. So man get infected by the bite of female Anopheles mosquito. Sporozoids are injected. Infective forms are sporozoids. Infective forms are infective forms are infective forms are. So they don't go to directly RBC. They go to the liver. There will be hepatosplenomegaly. They multiply in the liver and give rise to merozoids. Merozoids. They give rise to merozoids. They give rise to merozoids. They attack RBCs. So early ring stage, trophozoites, schizonts, and gametocytes. All these forms are seen in RBCs. Early ring forms, everybody, early ring forms, trophozoites, schizonts or schizont. You heard of a disease called schizophrenia? Heard or no? What is schizophrenia? Ah. Mental disorder. What happens in mental disorder? Hallucination. What is the difference between delusion and hallucination? Hallucination and delusion. What is the difference? Delusion means false perception. Hallucination? It is not there, you assume something is there. Whereas delusion is, what happens in schizophrenia? 1% of the medical student, according to the all leading articles, 1% of the mental students are schizophrenics. And in earlier days, we used to do ECT. You heard of ECT? Elective convulsive therapy. Every family you find one schizophrenic. In each and every family you find schizophrenic. So psychiatry is not, going to a psychiatrist is considered as pagalpan. Everybody thinks. But majority of medical students, dental students, nursing, all students, they suffer from depression. Most of them, they suffer from depression. So it is not, we don't identify depression. Most of them, सब पागल है. दुनिया में सब पागल है. Nobody is sane. Everybody, there is a saying that there is a hairline difference between a sanity and insanity. Every intelligent, better to be an average person, not to be too intelligent. The two intelligent person, Nobel laureates, all good, IQ of more than 160 only become pagal. Only those people not become a rank holder or gold medalist or something like that. Average is okay. If you get 50%, that's good enough. So if you could get 90%, two people will pass in that 90%. So the schizophrenia is split mind. There are various types. Still now we have not find out a good drug, anti-schizophrenic drug. We have lot of, even I had lot of students. I had one student coming to tuition and she used to write pharmacology and pathology, pathology and microbiology, microbiology, forensic medicine. Suddenly she used to dream something. Suddenly comes at 9 o'clock for the tuition. Sir, today we had tuition at 9 o'clock. I said, Mama, go back. So she used to come to my clinic and she used to cycles and scooters. She used to take reverse his car. So all the scooters and cycles used to follow. Tuck, 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 tuck. Of course, now she's is in remission. She's practicing medicine in the US. Now, these are seen in the this thing. Some of them are transformed into male and female gametocytes, which are sucked up by the mosquito, which are sucked by the mosquitoes. The life cycle in mosquito, male and female unite. They form zygote. Male and female gametocyte unite. They form zygote. Zygote transformed into ookinete. Ookinete, which pierces the stomach wall, comes into the extraperitoneal region, forms oocyst. Oocyst. Everybody. Oocyst burst, giving rise to sporozoites. Now, mosquito is ready to infect the person. So, laboratory diagnosis of malaria is done by examination of peripheral smear. We do thick and thin smear. Thick for the identification of parasite, thin for the identification of whether it's OVAX, OVL, pulsifer, and all these things. We do usually Jimsa stain, Jaswant Rai Bhattacharya stain, and best method is quick. We capillary tubes are uh, coated with acridine orange. You centrifuge is quantitative buffer layer is examined under immunofluorescent light, ultraviolet light. They fluoresce like a stars. They fluoresce like a star. So in nutshell, this is malaria. Malaria is by the bite of mosquito. Please remember. Next is Leishmania donwani. Man get infected by the bite of sandfly. Man get infected by the bite of sandfly. Phlebotomus argentipus. What is it? Phlebotomus argentipus. Man get infected by the bite of sandfly. Phlebotomus argentipus. Promastigote forms are infective and they become amastigote. And they infect the reticuloendothelial system. All macrophages, monocytes, and this is the skin of the reticuloendothelial system of the skin get infected. Skin becomes black, wrinkled, and it is called kalazar. It is called as kalazar, black fever. It is called as kalazar. It is called as kalazar. Next is Ballantidium coli, B. coli. It is a pig's parasite. Man get accidentally infected. Life cycle is same as of amoebiasis. It gives rise to Ballantiasis. It gives rise to Ballantiasis. Next one is Toxoplasma gondii. Man get infected by consumption of food and water contaminated with cat's feces. Cat's feces. So if it happens in the first trimester of pregnancy, it gives rise to congenital toxoplasmosis leading to blindness, deafness, and mental retardation. It's very dangerous. Next is free living amoeba. Neglaria and acanthamia. They are seen in the ponds and lakes and ponds and lakes, swimming pools. They give rise to primary meningoencephalitis. They give rise to primary meningoencephalitis. Now, opportunistic infection of the HIV, pneumocystis carinii, cryptosporidium, isospora belli. All this pneumocystis carinii gives rise to pneumonia. Cryptosporidium and isosporia belli gives rise to diarrhea in HIV infected patient. This is in a nutshell about the protozoans. How many parasites total? Couple of Babesia is there, which usually occurs in animals. They are seen in RBCs. The helminths are classified whole like this: three. Cestodes, Trematodes, Nematodes. Cestodes, Trematodes, and Nematodes. Cestodes, everybody. Cestodes, Trematodes, and Nematodes. Cestodes, Trematodes, and Nematodes. Cestodes, Trematodes. Cestodes are tapeworm. Cestodes are tapeworms. Trematodes are leaf-like worm. Trematodes are leaf-like worm. Nematodes are roundworms. Okay. Cestodes, trematodes, and nematodes. Everybody. Cestodes, trematodes, and nematodes. Cestodes are tapeworms. Trematodes are leaf-like worm. Nematodes are roundworms. Now we come to the cestodes. Cestodes. One is beef tapeworm. Beef worm, remember it as Tinea saginata. Beef tapeworm. By eating partially cooked or uncooked beef. I think how many of you eat beef? In Kerala, it was everybody used to eat beef. Even our Ranveer Kapoor is very fond of beef. So many WhatsApp messages. Now, then pork tapeworm. Pork tapeworm is called as Tinea solium. Tinea solium. Man get infected by ingestion of partially cooked or how many of you eat pork? Nobody. Thank you. Uh, by eating pork, partially cooked or uncooked pork. Then dog tapeworm. By ingestion of food which contains dog feces, which contains eggs. Eggs. Then you have fish tapeworm. Fish tapeworm has got two intermediate hosts, cyclop and fish. It is called Diphyllobothrium latum. Diphyllobothrium latum. Then rat tapeworm. It is called H. nana. Hemilopis nana. Nana, chacha, ka, bhanja, kaka, whatever it is. Hemilopis nana. Then dwarf tapeworm. Hemilopis diminuta. So how many you have? Beef, pork, 6. Hemilopis nana, Hemilopis diminuta, Echinococcus granulosus, hold like this, Diphyllobothrium latum. It is double-headed. Fish tapeworm, Hemilopis diminuta. So saginata and solium by pork and beef. By pork and beef, partially cooked. And solium sometimes by auto-infection. Please remember, we asked this question to all the students. How do you differentiate between male and female worm? There are no male and female tapeworms. They are hermaphrodites. Both sexual organ present in the same worm. They are hermaphrodites. Sometimes this gravid uterus falls back into the stomach. The eggs are through the vessels, they go to the brain and cause neurocysticercosis. Neurocysticercosis, it is a space occupying lesion and gives rise to convulsions. It gives rise to convulsions. It gives rise to convulsions. Dog tapeworm, it goes to the liver and gives rise to hydrated cyst. It gives rise to, come here, stand. Come here. Stand up here. Go and wash your face and come. Go. Go to the restroom, wash your face and come back. Go. That is a disadvantage of sitting in the first bench. You sleep off in front of the teacher. Okay. Now it gives rise to hydrated cyst. Done by intradermal test called Cassony's test. Diagnosis is done by intradermal test called Cassony's test. So you take 0.1 ml of Cassony's antigen. What is Cassony's antigen? It is a sterilized fluid of hydrated cyst and sterilized by Sheets filter which contains asbestos injected intradermally. The redness more than 6 centimeters is the immediate hypersensitivity reaction. Immediate hypersensitivity reaction, it gives rise to diagnostic of, it's most commonly asked question in your examination, Cassony's test. Cassony's test, okay? And Hemilopis diminuta. So please remember this Diphyllobothrium latum has got two intermediate hosts, cyclop and the fish. Cyclop and the fish. So now trematodes, nothing much because they are not very common diseases. Just name is enough to remember. In the examination, some 2 marks or 3 marks questions, some multiple choice may come in your NEET PG examination. There are cystosomes, Cystosome hematobium, Japonicum, and Mansoni. This is called border worm, which is present in the vesical venous plexus with terminal terminal thorn-like egg is like terminal this thing. It gives rise to painless terminal immature. It's common in South Africa. They consider as counterpart of menstrual cycle in the men. Now there is a fasciola hepatica, infects the liver. Hepatica, Physiolepsis busci, Clonarchy sinensis, then Paragonismus westermani. It's a lung trematode, westermani. So all this, you remember, Cercaria is the infective form. Cercaria, through the skin they come up. Here it is metacercaria, infective form. Just this, when you are after passing MBBS, when you are going through the postgraduate NEET examination, you go through this trematodes comprehensively. They ask, especially to make it more competitive and more so that you don't get good rank. You have to study immensely, make it more complicated. I mean, some of the multiple choice question are made it very, unless you Google it, you will not able to answer this. Okay. Now, helminths are very important from examination point. Still, we are fighting with these helminthic infections. There are one were present in the intestine. They are called intestinal. They are called intestinal nematodes. One which are present in the intestine. They are called intestinal nematodes. One is present in the other than the intestine. They are called visceral nematodes. Okay. The intestinal nematodes you remember as yeast mnemonic. So 1, 2, 3, 4, 5, 6, 7. There are 7 intestinal nematodes. How many? 7. There are 7. Okay, first one is Enterobius vermicularis. It is called pinworm, seatworm, threadworm. It is called as pinworm, seatworm, threadworm. It is present in the perianal region. It is common in children. All the time you feel like scratching your anal region. It's quite embarrassing. Don't say what is the treatment for Enterobius for itch guard. Don't say that. Okay. Sometimes mother will bring to you. You can see the worms in the perianal region. So we use the perianal swab. We collect by there is something, one special swab is there. That is, it has got a cellophane tape at the end. It is called NIH swab. NIH swab. National Institute of Health swab. Cellophane tape. So we take the swab, look under microscope. The eggs are plano-convex. The eggs are plano-convex, non-bile stained. Eggs are plano-convex, non-bile stained. The eggs are plano-convex, non-bile stained. 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 Next is Ascaris lumbricoides. Ascaris lumbricoides. Roundworm. It is called as roundworm. Ascaris lumbricoides. It is called as roundworm. Man get infected by consumption of eggs present in the food and water. There are two types of egg. One is bile stained, the elliptical non-fertilized. It is called unfertilized egg. So unfertilized egg, get up, go to the restroom, wash and come. Go. What to do here? Even I feel like sleeping. Why they made it so many worms? Why they should have so many worms? The unfertilized worms, if you see in the stool, you come to the conclusion that only female worm is there. No male worm is to fertilize. So very unfortunate. Only female is there. No, nothing is there. Male partner is there to copulate. Only you see the unfertilized egg. Fertilized egg is bile stained. It is round in shape with lamination with embryo inside. This is fertilized egg. So life cycle of Ascaris lumbricoides is not simple. When it goes to the intestine, it will not stop there. It goes to the lungs and comes back to the intestine and develops as a male and female adrenal. Please remember, life cycle of Ascaris lumbricoides is not simple. It goes to the intestine, goes to the lung, it creeps up to the trachea, comes back to the esophagus, and comes to the intestine and develop as male and female adult worm. Male and female adult worm. In lungs, it gives rise to Loeffler's pneumonia. It gives lungs, it gives rise to diagnosed by looking at these eggs. If you see only unfertilized egg, elliptical, non-embryonated, it is bile stained. This is unfertilized and this is fertilized. Okay. Next is Ankylostoma duodenale, Necator americanus. Ankylostoma duodenale, Necator americanus. Man get infected when he walks barefoot. When he walks barefoot on fecally contaminated soil. Man get infected when he walks barefoot on fecally contaminated soil. Filariform larva is infective. Filariform larva, through the veins, it goes to the lungs. Just like Ascaris, it comes to the intestine where they develop into male and female adult worm. In the intestine, they suck blood. In the intestine, they suck blood. They are called hookworm. Everybody hold like this. They are called as hookworm because anterior end is bent like a hook. Anterior end is bent like a hook. What are the other examples of hook? Why you are thinking so much? No other examples of hook. Huh? Simple. What is hook? You are not able to answer. In examination, what example hooks? Other hooks. In pant, you don't have hook. Huh? Suddenly, you started remembering something. Huh? So there are three hookworms: Ankylostoma duodenale, Necator americanus, Strongyloides tuberculosis. Life cycle is same. They go to lung, come back to the intestine. Through the veins, they go to the lung, come back to intestine, fertilize and lay eggs. Eggs are non-bile stained. Non-bile stained. They have 4 blastomeres. They have 4 blastomeres. Non-bile stained, 4 blastomeres. Non-bile stained, 4 blastomeres. Ankylostoma duodenale, Nectum americanus, Strongyloides circularis. Next is Trichuris trichura. Next is everybody Trichuris trichura. Trichuris trichura. Everybody. Wait. Irichiri. Trichuris trichura. It is called whipworm. Whipworm. What do you call whip in Telugu? Chabuk. So whip posterior end is thick, anterior is thin. NTR. What is it? The famous song Naushad's all घोड़ा गाड़ी and all. मांग के साथ तुम्हारा मांग लिया संसार. Not had seen movies. A lot of Dilip Kumar and Vaijayanti Mala's movies. We were not even born that time. दिल मिला दिलदार मिला. जाने दो. चलो, whipworm. Man get infected by consumption of egg. Egg is bile stained. It is barrel shaped. With mucus plug at both ends. It is barrel shaped with mucus plug at both ends. Barrel shaped. So life cycle is simple. It will not go to any place. It stays in the intestine, gives rise to abdominal discomfort, pain, abdomen, and all those things. Okay. The last one is Trichinella spiralis. It is commonly called as Trichina worm. Trichinella spiralis. Trichinella spiralis. Trichinella spiralis. Don't use my notifications are so important. Huh? Boyfriend, कहाँ हो तुम? कहाँ हो? मैं क्लास में हूँ, जल्दी आओ. क्या सुन रहे हो? वो बोरिंग लेक्चर से इधर आओ, हम चाय पियेंगे, कॉफी पियेंगे. थोड़ी देर वेट करो, मैं आ रहा हूँ. आओ ना. Okay, so but passing the MBBS is also very important, no? So Trichinella spiralis, man get infected by eating pork. By eating pork. And they do not stay in the intestine, they go to the muscle mass. And they get encysted in the muscle mass. So you have 7. How many? 7. In the enterobius vermicularis, threadworm, seatworm, pinworm, itchy worm, perianal itching, and it migrates to vagina, urethra, and gives rise to nocturnal enuresis, frequent urination in the night. Okay, especially in female. Next is Ascaris lumbricoides, roundworm. It goes to lung, causes low flux pneumonia in the intestine, abdominal discomfort. Eggs are bile stained, non-bile stained, elliptical, unfertilized, round, fertilized. Ankylosoma duodenal, Necator americanus, strongylite circularis. Man get infected by walking barefoot on fecally contaminated soil. How do you prevent this infection? Huh? What is that? Wearing shoes. You got a share in Bata company or Tata company or something like that? Shuddha Bharat, Swachh Bharat Abhiyan, providing toilet to everybody. Government Modi has said, if you do not have a toilet in your house, I think everybody has got toilet in this classroom. Sure? Open air defecation, nobody is interested. Don't do it. But people are fond of open air defecation. You know why? खुला हवा में, ठंडा हवा में, ठंडी हवाएं. So open air defecation, mixturation. Even my friends, when they come from US, they want, oh, mera desh mahan. They do open air defecation and mixturation. If you do the same thing, they get $100 bill. Most of the American cities are CCTV. They have put CCTV. If you go for walking, if you do mixturation or defecation, they get $100 bill to the house. So क्या है, क्या बात कर रहे हैं? कुछ डाउट है, मन में शंका है. शंका है तो हम दूर करेंगे. बोलिए, कुछ बोलिए, कुछ तो बोलिए. नहीं, कुछ नहीं, कुछ तो है. बात कर रहे थे उसके साथ. क्या बात कर रहे थे? कुछ नहीं है, कुछ तो होगा ना. कुछ चल रहा था तुम्हारा दोनों के बीच. दोनों बहुत अच्छे फ्रेंड्स है क्या? फ्रेंड्स तो है, उतना क्लोज? हाँ, कितना क्लोज? ठीक है. So not providing shoes, still 70% of Indian population are barefooted. They cannot afford shoes or chappals. Understand? So if you go to Mumbai, you have seen local trains there, and as soon as you enter India and go to the local train, most of the Lok Sabha, Vidhan Sabha takes place across the Patri line, railway, this thing. So all important discussion, Modi ऐसे क्यों किया, Modi ऐसा क्यों नहीं किया, all the discussion takes place along the railway line. So they will be happily chatting for half an hour. That is a morning session. Evening session, one more session. Okay, depending on how many sessions did. Shuddha, I mean Swachha Bharat Abhiyan, providing toilets to everybody. One simple thing of our Prime Minister. I am not this thing about the simple one, providing toilet. So many infections you can avoid. Providing toilet. Trichuris trichura, whipworm. Again, man get infected by mucus plug at both ends, barrel-shaped eggs, Trichinella spiralis, eating pork. Eating pork. Now coming to the laboratory diagnosis of, you have to most commonly, there will be stool examination in your practical. We are going to have practicals every week now onwards. So the stool examination, you have to draw the two eggs or one cyst and one egg and show, and the examiner will come and ask you question, life cycle, pathogenicity, clinical features, diagnosis, treatment, everything. So you get 10 marks, 10 or 15 marks, and bifurcation marks I'll put you in the group. So you have to draw the two diagrams. The first one is these are bile stain. There are three pairs of hooklet, look like a coin, and it is oncosphere. It is Tinea saginata and solium. They are bile stained. Tinea saginata and solium are bile stained. Next bile stained is a elliptical ascaris and fertilized egg of ascaris. Then Trichuris trichura. So you have TTA, TT80. Remember it as TT80. Tinea saginata, Tinea solium, Ascaris lumbricoides, Trichuris trichura. Trichuris trichura. Non-bile stained are Ankylostoma duodenale, 4 blastomeres, and Entropius Trichuris trichura. Sorry, Entropius vermicularis. Plano-convex, non-bile stained. So you have 80, TT80, TT80 bile stained, and Ankylostoma duodenale, Nectar americanus, Songlite circularis, and Entropius vermicularis. They are non-bile stained. They are non-bile stained. Okay. Now last two worms. Remember, last two worms are filarial worm. Filariasis. They cause filariasis. Especially Andhra has got a lot of coastal region. Filariasis is still common. So remember this leg before wicket. You know, Deepak, what is leg before wicket? Lemon before wicket. So loa, not love, loa. Brugia malai, Mucilaria bankrupti. Wuchereria bankrupti. Man get infected by the bite of Culex mosquito. Man get infected by the bite of Culex mosquito. Infective form is L3 larva. L3 larva. The habitat of this parasite is in the lymph nodes and lymph channels, lymphatic vessels and lymph nodes, and they block the drainage of lymph and lymphatics, giving rise to elephantiasis. Looks like elephant leg. It is also called as elephantiasis. Wuchereria bankrupti. Wuchereria bankrupti. Man get infected by the bite of L3 larva. Larva stage 3. Habitat of this parasite is in lymph nodes and lymph channels, and they block and swollen egg looks like an elephant leg. It is also called as elephantiasis. Laboratory diagnosis done by demonstration of microfilaria. Microfilaria, the Jimsa stain or Leishman stain, they are nocturnal in habitat. They come out in the midnight. So when we are doing residency program, they used to ask us, go to midnight and take the peripheral smear and look for the microfilaria. We used to enjoy going in the taking rounds in the wards. Microfilaria is seen in the they come. Or if you don't see microfilaria, there is drug called hetrazon, diethyl carbamazine. In fact, in coastal area, we had an ICMR project. We used to mix the common salt with hetrazon drug and distribute along the all the population. It's one of the national programs, filaria eradication program. Okay, so demonstration of microfilaria in the peripheral smear. Demonstration. The last form in the parasite is Dracunculus medinensis. It's also called as guinea worm. It is also Dracunculus. Everybody, Dracunculus medinensis. The longest nematode. Nobody has seen the male worm. The female worm escapes in the peritoneal region, comes out in the skin where water gets exposed, and starts laying larva. Larva get into the cyclops. When man drinks water which contains cyclops, he get infected with dracuntiasis or guinea worm infection. So, Deepak, when you go to as a health officer in a village where water is used for bathing and drinking, what you will do? Same water is used for bathing and drinking. Only one source is there, one well is there. They are using for both bathing and the. They are imagining something where drinking water. Huh? Boiling is very costly. You know how much gas cylinder costs? How? It's only one source. What is that? Any suggestion? Sukesh, sitting quiet. Any suggestions from anybody? Best thing is close the well. Make it as a pump well. So they can take bath in one side and take water for drinking on the other side. Put two outlets. The best way is to take a nice cotton cloth, filter it. So cyclops are quite big. They are not passable by cotton cloth. Cotton cloths. So in the examination, you will not be asked to do stool examination. Otherwise, your hands will touch the stool and put it sometime here, sometime like this, and all that. In olden days, we used to have this. फिर भी कर रहे हो सामने बैठ के मोबाइल कर रहे हो बताओ क्या है हाथ में अंदर रखा Unfortunately, we had no mobile in our time. You also would have done the same thing. चलो कोई आपको बुला रहा है जल्दी जाओ जाना है तो जाओ ना So this is in a nutshell the parasitology. Parasitology, 50 marks. 50 marks in your examination. 50 marks, general bacteriology, immunology and systematic bacteriology. 50 marks, general bacteriology, immunology and this thing. 50 systemic, 50 virology, mycology, 50 parasitology, 50. That is the distribution of marks in your examination. Okay. And we are system-wise syndromic approach. We have to tell you uh, the lung tapeworm, the which are musculoskeletal, which are in the blood, and all those things. Okay, now record booking dictation will be there. Wait here, collect your record books, come back. Go to the record book and collect.